Student delegates and teachers, it's an honor to be part of your preparations for the Model UN program this year. I want to thank the World Affairs Council of Philadelphia and especially Kristen Hutchison and her team in the education programs for giving me the opportunity to be part of your efforts. My name is Alex Otieno. I'm an assistant professor of sociology at Arcadia University. Arcadia is about 40 minutes from Philadelphia in Glenside, Pennsylvania. We are known for our programs in education at the graduate and undergraduate level, a physician's assistant at the graduate level, physical therapy at the graduate level, and public health at both the undergraduate and graduate level. We also have programming in a variety of the liberal arts, ranging from physics and chemistry and biology to the social sciences, international studies, religion, history, philosophy, sociology, criminal justice, and anthropology, where I teach. And we send students abroad to various destinations when COVID isn't a problem. So I hope that you will consider Arcadia in your future endeavors, either as a student, as a possible professor in the future, and the like. So today, my goal is to shed some light on health. So I'll define health a little bit, explore social determinants of health with you briefly, how social conditions impact health. I will talk about the targets of the Sustainable Development Goals. As you are all aware, SDG number 3 on ensuring good health and well-being for all at all ages has multiple targets that address health and well-being. So I'll identify some that you should probably consider as you negotiate, debate, discuss, and write your resolutions. Some challenges for health systems and the work that the United Nations and the World Health Organizations have done in addressing health issues, and conclude with some recommendations for you as future leaders. So what is health? Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a definition from the World Health Organization's constitution that really kind of itemizes 3 components of health: mental, physical, and social. And so as we explore these questions, it's important to think about the ways in which health is not a single component, not just physical, not just mental, not just social, but how all those 3 are involved in an individual's health and an individual's well-being. I also want to reference 2 leading individuals from historical period preceding our time, Mahatma Gandhi, who says it is health that is real wealth and not pieces of gold and silver, and American philosopher and poet Ralph Waldo Emerson, who noted that the first wealth is health. An emphasis in both cases on how health and wealth are related, and that health is the foundation of wealth as opposed to wealth being the foundation. Social determinants of health are important to note because we know that health is linked to economic stability, to educational access and quality, to healthcare access and quality, to neighborhood and built environment, to social and community context, especially the well-being component of health, and that the health of an individual is informed by the conditions and environment in which the individual is born, where the individual lives, where the individual works, where they play, where they worship, and where they age. And that all of this affect the individual's functioning, as well as the quality of quality of life outcomes they have, and the risks associated with their everyday lives. So I'm trying to position this so that you think about the integrated nature of health and to consider related SDGs, such as SDG on sanitation, gender equality, SDG on hunger and poverty as relevant to health as well. We are exploring these questions at a time when the world is facing COVID. And as you know, COVID has had multiple impacts on the health and well-being of individuals that range from disrupting efforts to control malaria in Africa, sub-Saharan Africa specifically, where there's been a spike, as well as it's interrupted childhood immunizations, it's interrupted improvements in areas such as child health, maternal health, HIV, and tuberculosis control. And it's also highlighted the fact that less than half of the global population is covered by essential health services. So highlighting the need for universal health coverage that you will need to contend with as committee members as you write your resolutions. Two key challenges are related to these issues. The first one is the need for investing $200 billion every year aimed at primary healthcare. Fully aware that by doing so, you could save 60 million lives during that same duration of time. The second one is investing 1% of your gross domestic products to close the coverage gap, the less than 50% of the globe that is covered by essential health services. We could close that gap if UN member countries increase their spending on primary healthcare by 1% of the GDP. So there's two clear challenges that are related to investment. I also want to emphasize the importance of good health and well-being from a different perspective, knowing that the sustainability and economic growth of communities are contingent on their citizens or their members of those communities being healthy on the one hand. But on the other hand, also thinking about how poor health leads to higher mortality rates, as well as lower life expectancy. And then the other part to consider is the ways in which poor health affects healthcare workers that are available to treat those who are ill by making them indisposable, unavailable to treat and to work. And how in the era of COVID-19, we've seen how poor health makes individuals susceptible to COVID and also more vulnerable to COVID. So individuals with better health fared much better with COVID than those who had pre-existing conditions, such as heart disease, diabetes, high blood pressure, asthma. So it's important to maintain good health or improve individuals' health. Lastly, poor health results in health inequalities within countries. So in countries such as the United States of America, where you're all going to school, we know that there are health inequalities between racial groups. Native Americans living in reservations have health outcomes that are much less desirable than those of their white compatriots living in cities and towns that have better access to care, access to water and sanitation and the like. And that also applies to African Americans and Latinx people whose health statuses and health outcomes have been noted to be poorer than their white compatriots. There are several ongoing health systems challenges, and it's important to define a health system as a way a nation organizes itself to protect and fulfill the right to health of every citizen. These include providing them with public health services and medical care services, as well as efforts to surveil diseases, to track diseases, document them, and the like. The key efforts in this regard are universal health coverage, which is a key target of SDG 3, expanding access to vaccines, that is immunization of children and adults. We see now COVID vaccine as a key part of allowing economies to reopen, people to go back to work, teachers to go back to school, ending the need for Zoom schooling or Google Meet schooling for some of you, and addressing maternal and child health, and supporting healthcare workforce, which is very crucial, and I'm going to talk about that shortly, and providing health information management and tracking, which is important in terms of comparing where things were, where things are going. You need to have a system for managing that kind of information to be able to have a dashboard where you can see where were we before, where are we now. So healthcare, health systems, not healthcare, but health systems more generally, have these challenges in common, and that is across developing and developed countries. Developing countries are less able to provide all of these things than developed countries. For instance, we know that the Netherlands and Sweden recently improved their coverage by initiating efforts to expand access to its citizenry. However, then undocumented or non-official citizens of their countries continue to face lack of access in those two countries. So it's important then, as we are considering universal coverage, to also consider individuals and their immigration status and how that might impact them and what countries can do to address those kinds of gaps. The targets that might be worthwhile to explore, all targets are important under goal number 3, but the following targets are specifically relevant and also highlight the both the social determinants of health that I talked about earlier on in terms of the economy, the environment, the places people are born, go to school, work, play, and live, and age. So reducing by 33% premature mortality from non-communicable diseases. We know that exercise, access to good food have an impact on that. The built environment has an impact on that. Roads have an impact on that. Reducing by 50% the number of deaths and injuries from road traffic accidents. Particularly, we could also focus on preventing and treating substance abuse, which may be related to deaths and injuries from road traffic accidents in the United States. We know that drunk driving is a major challenge, but that through campaigns, we've been able to manage and reduce cases of drunk driving, campaigns such as having designated drivers, but also enforcing the laws. And then target number 3.6, which addresses reducing injuries and deaths more generally. So that is related to preventing and treating substance abuse. So people who are under the influence do not drive vehicles. So and reducing the number of people who are under the influence by, again, campaigns to change people's attitudes toward substances and delay the age at which people start using substances, help people to rehabilitate if they were using substances. So there are multiple levels of interventions that can be pursued in that regard. And then reducing illness and death from hazardous chemicals and pollution, and increasing health financing and support supporting health workforce in developing countries. So those are goals or targets within the goal number 3 that could be worthwhile of your time and attention as you explore the way forward. Specifically, with regard to supporting healthcare workforce, it's important to remember that if at current projections, there will be 18 million healthcare workers shortfall by 2030. So in the next 9 years, something needs to be done to address that gap, maybe perhaps every year, producing 2 million more workers than would have been produced absent such intervention. So it might be worthwhile for member countries to explore the ways in which they could contribute to this production. Similarly, we have to think about the differences between low income and high income countries, as well as small island nations. What are the unique challenges that these countries experience, such as the immigration of their healthcare nurses and doctors to more affluent countries, or their lack of capacity to attract healthcare workers and retain them. So even after they've trained them, they may leave for quote unquote greener pastures. So how do we address that? Might there be a collaboration between developed countries and developing countries to reduce that gap by working together? The other interrelated targets pertain to maternal health. For instance, how might we address prenatal care, skilled birth attendants, including midwives, making them available at the local level, and postpartum care at one level, and also addressing the relationship between mothers and their daughters at the family level. So you have the health system level, but then you also have the family level. How might we improve that? So improving education, for instance, would make it more likely that the communication of information may be available between mothers and daughters. Going back to some indigenous practices and indigenous knowledges for low-income countries, that might also help bridge the gap so that there's a better understanding of questions around birthing and child rearing, especially for newborn children. The other target is universal access to sexual and reproductive care and family planning and education. So that is something that is interrelated to this larger goal of reducing maternal mortality. The overall target here is to reduce maternal mortality ratio to under 70 per 1,000 live births by 2030. So that's a tall order given the state of things now, but it is attainable with collaboration, with innovation, with tenacity on the part of national governments, with tracking, and with training of healthcare providers. This also requires, as I mentioned earlier, universal access to sexual and reproductive services and access to education. And then at another level, addressing racism, sexism, and class discrimination that may be an impediment or an obstacle for women who are seeking care in countries where racism, sexism, and classism have been noted as problems. The other goals pertain to reducing mortality among under 5-year-olds. And so the goal is to reduce it to as low as 12 per 1,000 live births for under 5-year-olds, and to as low as 25 per 1,000 live births for the under by 2030. So again, I think I should go a little slower with that. So the goal here, goal number 3.2, is to prevent deaths of newborns and children under 5 years of age with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. It seems daunting, but it's doable. It requires interventions at the local level, at the tertiary level, and at the environmental level. So there's possibility, but those goals are not beyond attaining. Some possible actions, I already started alluding to this, is enhancing prevention at primary, secondary, and tertiary level. So preventing illness in the first place, but once people are ill, be they the babies or the under 5s or the mothers, making sure that they can receive the necessary treatment services. And again, this speaks to the universal health coverage that I alluded to before and availability of healthcare workers. So you're beginning to see how they are interrelated and how they intersect. And then addressing this at both the individual, the communal, the societal, and environmental levels. So there are individual issues. How do we empower individual people to take the necessary action? How do we shift the community's attitudes toward women or toward young girls, toward providing care, toward ensuring access to reproductive health services? How do we change society? And then the environmental conditions that may affect, say, the lungs of a young child. How do we change those environmental conditions in order to facilitate flourishing or thriving for young children and mothers, in case of mothers? Then how do we optimize and sustain regional and global cooperation to address good health and well-being? We know, for instance, that under current conditions with COVID, there has been an initiative, a public-private partnership involving corporations, governments, and international organizations, including the World Health Organization, which I'll talk about shortly, under the broad umbrella of COVAX, that is trying to facilitate access to COVID vaccines for low-income and middle-income countries. So those kinds of initiatives may also offer a path forward. And then last but not least is global collaboration and innovation through the World Health Organization. And I'll talk about some of the work that the World Health Organization has done recently in healthcare worker training and helping countries achieve universal health coverage, and addressing global health risks, including monitoring, notifying countries. But the work of the World Health Organization requires support by national governments. So each of your member countries can support the WHO through your contributions, through welcoming them, through working with them at the regional level and at the national level. It's important to remember that you represent a country that is part of the United Nations. And the United Nations, since its establishment in 1945, following the Second World War, has done a lot of good in the world in terms of securing peace and promoting development, with particular emphasis on human rights. There are many covenants and conventions, including those that address health, the International Covenant on Economic, Social, and Cultural Rights, ICESCR, the International Covenant on Civil and Political Rights, or the International Convention on Elimination of Racial Discrimination, all address health. And so the United Nations has been a trailblazer in beginning to get us to think about health as a human right. It's also created organizations within it. So it's specialized organizations such as United Nations Development Program, United Nations Women, and the World Health Organization, which is a specialized agency of the United Nations, have also done a lot to improve health and well-being. The United Nations has led in decolonization, peacekeeping, and peace building. And so decolonization of countries in sub-Saharan Africa, in Asia, in Latin America, involved the United Nations. The United Nations has also participated in a great deal of international relations and cooperation, building networks among member countries. And finally, it's promoted equality, especially gender equality and racial equality. Now I'm going to go on to the World Health Organization and just a brief overview of the work that the World Health Organization has done. It has responded to health emergencies, most recently COVID. It's still leading the response of COVID. Before COVID, it responded to Ebola outbreaks in West Africa and the Democratic Republic of the Congo before that. It has responded to the HIV and AIDS crisis from the late 80s through the 90s and the 2000s. It's also involved in direct funding of programs that administer essential services, including training doctors and nurses and providing of life-saving vaccines and other critical projects. The World Health Organization has also led countries in adopting law as a way of addressing challenges such as tobacco use, as well as addressing diet challenges, so unhealthy diets, so by using law. So the Framework Convention on Tobacco Control, for instance, was led by the World Health Organization. The World Health Organization has also led the International Health Regulations, IHR, which were most recently updated in 2005 and spell out the processes for reporting diseases to the international community in case a disease is deemed a notifiable disease. The World Health Organization helps countries with national health policies, strategies, and plans. So most of the member countries that you represent have benefited from the expertise of the World Health Organization in that regard, as well as improving health systems, information, and evidence gathering, which is crucial for health systems improvement. The World Health Organization similarly has led access to medicines and other health technologies and strengthening of the regulations in various countries. In other words, it is a crucial part of the international health system capacity building and efforts to integrate people in as people-centered health services as part of the global discourse or the global conversation. I want to end by highlighting the fact that you, as members of the UN model UN program, change agents. You are building your own capacities to engage with questions around SDG number 3 specifically, but Agenda 2030 on sustainable development more generally. Your capacity building as a young person will help us as a globe to envision a different future, the future that is only possible through your efforts. You can ask yourselves what strategies and approaches would ensure inclusion, thereby allowing us to leave no one behind and allowing us to enhance the right to health and SDG number 3 more generally. You, each of you, student delegates, will become or already are culturally very aware, and your intercultural awareness will put you in a position to work for global social change. So again, as we move forward toward 2030, I'm counting on you as transformative forces that will help us achieve the targets of SDG 3. I want to wish you all the best in your deliberations, in your committee work, and in your future endeavors as global leaders. Thank you.